Over the past 2 weeks, 780 new cases have been identified in the province, with 57% of these cases being under the age of 40.
Concern from Alberta's top doc that pandemic fatigue is rolling across the province.
We need to avoid overcrowding in public spaces and social gatherings.
Something Albertans need to keep in mind as they flock to the beaches, beyond our borders, and up in the sky. Public health officials in Manitoba say 1 of 5 people just diagnosed with COVID-19 had traveled to and from Calgary aboard WestJet, from Winnipeg to Calgary June 27th and returning home July 2nd. Like many airlines, WestJet had adopted the use of face masks on flights, but has reduced previous social distancing measures like empty middle seats that were put in place during the peak of the pandemic. Dr. Hinshaw says as more people travel interprovincially, spread can happen easily.
We are working closely with all of our provincial colleagues whenever an exposure like that happens to make sure that appropriate follow-up happens, just like we would if we had a local case that was exposed in Alberta.
However, Hinshaw wants people to remember that spread can happen anywhere and to anyone. She spoke of an incident where 6 Sitka Nation members were discriminated against by a local business due to an outbreak on the First Nation.
When the result of that prompt and transparent action is stigma against their members, it sends a message against transparency and risks discouraging people from being tested or cooperating with public health.
When it comes to testing, nearly 6,000 tests were completed in the last 24 hours, resulting in 86 new cases. The number of people in hospital has jumped to 55, with 13 in the ICU. 2 more deaths were announced, including one at the Misericordia Hospital, where there remains an outbreak of 49 cases. In Calgary, Tara Overholt, City News.